Hello, teacher.
Hello, my dear Arda.
Teacher, I want to ask one of the questions that gets asked a lot again.
Sure.
Who can undergo laminate veneer application? If there are situations where it cannot be done, what are the alternative treatment methods? Which ones do you prefer?
Laminate veneer treatment can generally be applied to almost everyone to a large extent. If we need to evaluate the situations where we cannot apply laminate, it can be applied to almost everyone to a large extent. If we need to evaluate the situations where we cannot apply laminate, these are individuals with gum disease. So if we apply laminate to someone who has any disease or problem in their gums, this can lead to the progression of gum disease.
So, should we treat the gum disease first?
Of course, if a laminate veneer procedure is going to be done and the person has a problem with their gums, the gum issue needs to be addressed first. Another reason is if there is severe damage to the tooth where the laminate is going to be applied, meaning if there is a significant amount of decay or loss of tooth structure that cannot support the laminate we are applying, it needs to be repaired. What needs to be done? We will either support it with a filling and apply a laminate veneer, or we need to evaluate this procedure with some aesthetic covering or zirconia crown instead of applying a laminate veneer to this tooth.
So, teacher, do we only apply these if there are issues related to oral and dental health? Or do we also consider other health conditions? First,
I understand what you mean, my dear Arda. So you're saying we only don't apply it if there's a problem with the tooth. Another reason we might not apply laminate is if there are skeletal disorders. What does this mean? Applying laminate requires careful consideration of teeth closure. We avoid laminates in class 3 occlusion, where the lower jaw is in front of the upper jaw. In tete-a-tete cases with direct overlap, laminates are not recommended. Applying laminates in these situations can lead to chipping, breakage, or detachment. If you ask what the reason for this is, it's because the closing movement of the teeth applies opposing forces to the laminates during speaking and eating. This is not just for class 3 cases, but also in situations we call tete-a-tete, where the lower and upper teeth overlap each other directly. In such cases, we prefer not to use laminates. If we choose to apply laminates in such cases, we might encounter issues like chipping, which refers to small breakages at the edges, and sometimes the laminates can come off, break, or crack. In such cases, meaning if there is a skeletal problem, we should first resolve this skeletal issue with orthodontic treatment. That is, we need to bring the position of the teeth to a point where the upper jaw covers the lower jaw. That's how we prefer to apply it.
so it needs to be made suitable first. The structure of the mouth, the position of the jaws, the upper jaw, the lower jaw, these need to be suitable.
Of course, it's not just about the teeth. Gum health is also very important when applying laminates in the correct position of the jaw. If laminate procedures are applied without paying attention to these factors, we may encounter issues such as laminate losses and complaints from our patients. First and foremost, a good examination, proper treatment planning, and then moving on to the application is necessary. So, the belief that everyone can get laminate is definitely wrong.
And the same method may not be applicable for everyone.
Of course,
It varies from person to person.
first of all, a good planning needs to be done.
Sure, teacher. Thank you very much for the valuable information you've provided.
You're welcome, my dear Arda. We have a request for those watching us. We would be very happy if you could follow us, like, and share.
Yes, please. Subscribe, turn on notifications, and stay tuned for our upcoming new videos.
Thank you very much.